Hello, everyone. Let's dive into more ethics. Case number one. An 80-year-old male with a history of hypertension, type 2 diabetes, and mild cognitive impairment presents to your clinic for a routine follow up. His son reports that he has been forgetting to take his medications regularly and has had a few episodes of confusion at home. He is currently prescribed losartan for blood pressure control, metformin for diabetes, and a statin for hyperlipidemia. His son is concerned about his ability to manage these medications independently. Which of the following strategies would be most effective in improving medication adherence and ensuring compliance in this patient? In elderly patients with cognitive impairment, especially those who are forgetful, a multifaceted approach is necessary to improve medication adherence. Option A. Instruct the patient to keep all medications in a single large bottle to simplify administration. A large bottle is not ideal because it could make it more difficult to track daily doses and increases the likelihood of confusion. Option B. Recommend a weekly medication reminder device and provide family education to regularly check if medications are taken. The use of weekly medication reminder device can help ensure that medications are taken on time, while providing family members with the tools and education to monitor adherence enhances compliance. Regular follow-up and supervision can mitigate the risk of missed doses or confusion. Option C. Suggest that the patient switch to a medication regimen requiring less frequent dosing, for example, once daily dosing for all medications. Switching to less frequent dosing might help, but it is not always feasible for all medications. Also, changing regimens without addressing cognitive deficits may not be a sufficient long-term solution. Option D. Encourage the patient to use a pill box and allow him to decide when to take his medications based on his own preference. Pill box with self-administration may not be effective for a patient with cognitive impairment, as this relies on the patient remembering to take the medication correctly. Option E. Advise the patient to have his medications delivered to his home by a pharmacy service and rely on his daughter to manage them. Delivery service might help with convenience but still relies on the daughter for management and doesn't address the patient's need for structured medication reminders. Option B is correct because weekly medication reminder device provides structured reminders and family education ensures oversight, which is critical for patients with cognitive impairment to improve adherence and prevent missed doses. For example, electronic pill dispensers, automatic medication reminders, or apps with auditory and visual cues help structure the patient's medication taking process and reduce reliance on memory. Case number 2. A 66-year-old woman is diagnosed with advanced pancreatic cancer and her prognosis is poor. Her oncologist has recommended palliative care. During the follow-up visit, the patient expresses a desire to understand her diagnosis in full. However, her family, who is present at the visit, asks you not to tell her the full extent of the diagnosis, citing concern for her emotional well-being and fear of worsening her anxiety. They request that you withhold the information from her. Which of the following is the most appropriate next step in managing this situation? A. Respect the family's wishes and avoid discussing the diagnosis with the patient. This is ethically problematic. While families may feel protective, the patient has the right to know the full details of their diagnosis, and withholding critical information can undermine their autonomy. B. Inform the patient of the diagnosis in full, overriding the family's request because the patient has the right to know. While this respects patient autonomy, it may overlook the family's valid concerns about the emotional impact on the patient. It could cause unnecessary conflict or harm without first understanding the family's viewpoint. C. Discuss the diagnosis with the family alone and only provide limited information to the patient. This option does not involve the patient and violates their right to know their health status even if the family's concerns are understandable. D. Ask the family to leave the room and then discuss the diagnosis with the patient in a sensitive and supportive manner. This is an effective strategy for patient autonomy, but it may lack the collaborative discussion with the family that could help to allay their concerns. A sensitive private conversation with the patient is still necessary but should ideally follow an exploration of the family's perspective. E. Take time to understand the family's concerns, involve them in the decision-making process, and then discuss the diagnosis with the patient in a compassionate manner. This is the best approach. By taking time to understand the family's concerns, you can address their fears or reservations. This can help them feel more involved in the process and may lead to more collaborative approach to disclosing information to the patient. Involving the family in the decision-making process is key, especially when they have concerns about how the patient might react emotionally. After addressing their concerns, you can proceed with the disclosure of the diagnosis to the patient in a sensitive and supportive way. Case number 3. A 74-year-old woman is admitted to the hospital after a stroke. She is unable to communicate and requires urgent decision making regarding her care. The patient's daughter, who is her primary caregiver, is at the bedside and requests that the patient be transferred to a different hospital for specialized care. However, the patient's son, who is also listed as her next of kin, disagrees, arguing that it is too much for their mother to endure given her frailty. The hospital ethics committee is consulted to help resolve the conflict. According to the hospital policy, which of the following individuals has the legal and ethical right to make a medical decision on behalf of the patient if she is unable to communicate? In cases where a patient is incapacitated and unable to make their own decisions, the medical decision authority generally follows a legal hierarchy of next of kin. The hierarchy can vary slightly by jurisdiction, but it typically follows the order: 1. Spouse, if still alive; 2. Children, often in order of legal next of kin, such as the oldest; 3. Parents; 4. Siblings; 5. Other family members or legal guardians. Let's look into the answer choices. A. The patient's daughter, as she is the primary caregiver. This is incorrect because while the daughter is primary caregiver, the role does not necessarily give her priority over the legal next of kin unless she has been designated as the patient's healthcare proxy or power of attorney. B. The patient's son, as he is listed as the legal next of kin. This is correct because the son is the legal next of kin after the patient's spouse, assuming the spouse is not available or involved in the decision making. The legal next of kin is generally given priority in medical decision making. C. The patient's daughter, as the person who is physically present and actively involved in the patient's care. This is incorrect because the daughter's presence does not automatically confer decision making power. Physical presence alone does not override the legal hierarchy. D. The patient's oldest living relative, as there is no specific hierarchy for decision making. This is incorrect because decision-making authority is based on legal next of kin, not necessarily on age or who is the oldest living relative. E. The patient's spouse, if still alive, has priority over children regardless of their presence. E is incorrect because while a spouse has priority over children in some situations, this question assumes the spouse is not involved or is not present, so the son, as the legal next of kin, would take precedence. Understanding the hierarchy of next of kin and knowing who holds decision-making authority is critical in resolving conflicts in situations where patients are incapacitated. Case number 4. A 29-year-old woman has been seeing her primary care physician for several months for routine care. During a follow-up visit, she confides in the doctor that she has developed romantic feelings for him and expresses interest in pursuing a relationship outside of the doctor-patient relationship. She says, "I feel a strong connection with you and I think we could be more than just doctor and patient. I've been thinking about it a lot." Which of the following responses would be the most appropriate for the physician to say in this situation? In this scenario, the physician must maintain professional boundaries and adhere to ethical guidelines that prohibit romantic or sexual relations with the patients. Doctors are ethically required to avoid situations where their personal feelings might influence the care they provide or lead to exploitation or conflicts of interest. A. I understand that feelings can develop, but I must tell you that it is against the rules for a doctor to become romantically involved with the patient. It is important to maintain professional boundaries in our relation. This is correct because it acknowledges that feelings can develop in any human interaction, but it clearly sets boundaries by stating that romantic relationships between doctor and a patient are ethically unacceptable. It maintains professionalism and reaffirms the importance of maintaining a professional relationship. Option B. Thank you for being honest with me. I think you're a great person, but I'm also attracted to you. Maybe we can meet outside the office sometime to discuss this further. This is inappropriate because it implies that the doctor reciprocates the feelings or is willing to pursue a relationship outside the professional setting. This violates ethical guidelines about doctor-patient relationships and introduces a conflict of interest. C. I'm flattered, but I can't continue seeing you as a patient if you feel this way. I will refer you to another doctor who can take over your care. This could be seen as overly abrupt and does not address the situation with sufficient sensitivity. While referring the patient to another doctor might be necessary in some cases to avoid potential conflicts of interest, the physician's primary responsibility is to maintain professional boundaries and to redirect the conversation without immediately severing the doctor-patient relationship unless absolutely required. D. That's a very flattering thing to say. I'll think about it, but we can discuss it further once your treatment is completed. This is problematic because it suggests that the doctor might consider pursuing a relationship after the patient's treatment is complete, which is also an ethical violation. Romantic relationships with patients are never appropriate even after the doctor-patient relationship ends. E. I understand how you feel, but I'm not interested in pursuing a relationship with you. It's best that we keep our relationship professional to ensure you receive the best care. This is a bit more professional, but it still contains problematic elements. While it's important to reject the patient's advances, the responses should emphasize that it is not just about personal disinterest, but about adhering to ethical standards in medical practice. So the answer is A. This maintains a professional tone while setting boundaries in the doctor-patient relationship. Case number 5. A 6-year-old child presents to the emergency department in an unconscious state after a car accident. The parents are unavailable, but the child is accompanied by a nanny. The attending physician must perform an urgent procedure to stabilize the child. Who should the physician obtain consent from to proceed with the treatment? A. The nanny, as the child is in her care. The nanny does not have legal authority to consent to medical procedures unless explicitly authorized by the parents, as she is not a legal guardian. B. The child's eldest available relative who is present with the child. The eldest relative does not automatically have legal authority to provide consent unless they are the legal guardian or designated decision maker. C. The attending physician, as consent can be implied in emergency situations. In emergencies, when a child is unconscious and immediate treatment is needed, consent is implied under the doctrine of implied consent to prevent harm or death. The parents may be simultaneously contacted to save precious time. D. The parents must be contacted before any treatment is performed. The treatment can proceed without waiting for parental consent if delaying treatment could harm the child. E. The hospital legal team to verify who can provide consent in this emergency. In most emergency cases, the physician can proceed with treatment under implied consent and does not need to consult the legal team in real time unless there is a complex legal issue. The goal is to act quickly to prevent harm, and consent from the parents is assumed, even if not explicitly given, in life-threatening emergencies. However, if the treatment is less urgent, the physician should attempt to contact the parents as soon as possible. So the answer is C. Thank you for listening. Navigate smarter, lift learning, and enrich your mind. Don't forget to like, share, and subscribe.